Pelvis is made up of two innominate bones that form the side wall of the pelvis. And then one sacrum that forms the posterior wall of the pelvis. And then we have the coccyx, one coccyx. So all these together form what we call the pelvic girdle. It will form what we call the pelvic girdle. Now, we are going to pick them one by one and then describe them so that you'll be able to understand it and apply it when it comes to labor. Okay. So the innominate bones, I said all these constitute to the formation of what we call the pelvic girdle. The pelvic girdle. Okay. So the innominate bones. We have the ilium. The ilium, there are three bones that are fused together. Three bones that are fused together to form the innominate bones. So we have the ilium, the ischium, and then the pubis. This, I'm taking it again. I'm taking it again. We have the ilium, the ischium, then the pubis, or the pubic bone. These three bones are fused together to form the innominate bones. One here, one there. Now let's see the ilium. The ilium forms the upper to fifth of the acetabulum. The acetabulum is the dipping area here where it receives the head of the femur to form the hip joints. That is the acetabulum. So I'm saying that the ilium forms the upper to fifth of the acetabulum. It is made up of a flattened surface or a flattened area that is a bit concave. It's a bit concave. And the concavity here is for the attachment of iliacus muscles. The concavity is for the attachment of iliacus muscles. The posterior aspect is, however, roughened, and that gives attachment to the gluteal muscles. On the top parts of the ilium, it has a crest. It has a crest known as the iliac crest, which everybody can feel it when you place your hand at the waist side. You place your hand there and you can feel, no matter how fat you are, you can feel the iliac crest, and that is the iliac crest. Anteriorly, the iliac crest terminates, or it ends, or it stops here to form the anterior superior iliac spine. I'm going over it. I said the iliac crest terminates at its anterior portion to form the anterior superior iliac spine. Most of the external pelvic measurements are taken from this spine. Now, about 2.5 centimeters below, please look at it. About 2.5 centimeters below the anterior superior iliac spine, we have another spine called the anterior inferior iliac spine. Please, any question? If you have a question, unmute yourself and ask the question before I continue. Any question? I can see people's hands up. So if you have any question, just unmute yourself and then ask the question before I continue. Shall we continue? The inner aspects of the ileum, this side. The inner aspect of the ileum.
Join the meeting.
Come again. Come again. The inner aspect of the ileum has a ridge of bone known as the iliopectineal line. Iliopectineal line. Most of the transverse measurement of the pelvic rib is taken between these two iliopectineal lines. Is that okay?
Okay.
Any question? Now, in front of the iliopectineal line, this line, in front of this line, there is a thickened portion that can be found just in front of the iliopectineal line, and it is known as the iliopectineal eminence. It is known as the iliopectineal eminence. The thickened portion there, its function or its purpose is to prevent morbid penetration of the head of the femur through the acetabulum. I've already told you the importance of the acetabulum, that it receives the head of the femur to form the hip joints. Now, I said the iliopectineal line, just in front of the iliopectineal line, is a thickened area known as the iliopectineal eminence. Iliopectineal eminence. And the function of this iliopectineal eminence is to prevent morbid penetration of the head of the femur through the acetabulum. Other than that, had it not been the iliopectineal eminence, like somebody would be walking, the woman would be walking, and then the head of the femur would pierce through. It will pierce through and come inside the pelvis. But God didn't make it so. And so it prevents apart from that. Apart from that, the iliopectineal eminence also helps with the
Mute yourselves. You are disturbing the class.
To enter the pelvis. So that is it. Please, do you have any question? Where I have gotten to? Do you have a question for me? Is there a point I said you didn't understand? I can go over it. Are you okay? Can I continue? Please,
yes, ma'am. Auntie, please, can you repeat the iliopectineal line for me?
You say what?
Please, can you repeat the function of the iliopectineal line? Like, what is it?
The iliopectineal line.
Okay.
I said that the iliopectineal line, most of it is a line that lies in the ilium. And I said most of the transverse diameter of the pelvic rim, the measurement of the transverse diameter of the pelvic rim is taken between the two iliopectineal lines. And I said in front of the iliopectineal line, this side, then we have a thickened portion known as the iliopectineal eminence. Known as the iliopectineal eminence. And I've spoken about two functions of this iliopectineal eminence. I said it prevents penetration of the head of the femur through the acetabulum. Okay. And again, nobody else to see me. And I said, apart from that, The ilioperitoneal eminence also serves as a point where the fetus engages, so that between the promontory of the sacrum and the ilioperitoneal eminence, that's where the baby will use that diameter to enter the pelvis. So that is the importance of the ilioperitoneal eminence. Now, let's see the medial aspects of the ileum. You know, when you went for your nursing program and the midwifery program, if you remember, there were certain things that we talked about as prefaces and surfaces. Prefaces and surfaces. You heard of superior, you heard of inferior. Please take note of this thing that I'm telling you, because we are going to use it throughout the anatomy of the reproductive system. You heard of prefaces. That is superior, inferior, medial, lateral, anterior, posterior. Please, we'll be using these surfaces and prefaces a lot. Every organ or structure that you want to describe, without going by this superior, inferior thing, you can't follow well to give a meaning to the organ that you are describing. So take note of it. So that's why I said the medial aspect. So the medial aspect of the ileum, it articulates. There's a joint there. It articulates or joins. It joins the lateral side of the sacrum to form a very important joint in the body. And that is what we call the sacroiliac joint. Sacroiliac joint. And it is the strongest joint in the body, the whole human body. It is the sacroiliac joint that is the strongest joint of the body. Take note of that. So that is all about the ileum. Any question on the ileum? I've told you that the innominate bones is made up of 3 bones: the ileum, the ischium, and then the pubis.
Hello, madam.
Yes, please. Yes.
Please, is that the ilioperitoneal eminence? What is its function?
Its function.
Yes, please.
I said the ilioperitoneal eminence. Its function is that because of the way it is taken up here, because of the way it is taken up, it prevents penetration, morbid. I use the word morbid because it's a sharp one. It prevents morbid penetration of the head of the femur through the acetabulum. The ilioperitoneal eminence can be found just behind the acetabulum. It can be found just behind the acetabulum. I hope it's clear. Okay.
Hello, madam.
And then I said another function of the ilioperitoneal eminence is that it serves as a yardstick or a measure of the oblique diameter of the pelvic rib, so that between the promontory of the sacrum and the ilioperitoneal eminence, you get a measurement we call sacrocotyloid dimension. We call it sacrocotyloid dimension or diameter. It measures 9.5. It measures 9.5. That means so that if you ask you, where can you take, or where does the measurement of the sacrocotyloid dimension start from? You can easily say it starts from the promontory of the sacrum obliquely to the opposite ilioperitoneal eminence. And it measures 9.5. And that is the measurement or the diameter that the fetus uses when it is entering the pelvic cavity or when it is entering the brim. Let's start with the brim first. Before it enters, that's the diameter. So that's what I said. Is it okay? Is it okay?
Yes, please.
Okay.
Yes, please. Thank you very much.
You're welcome. Can I continue? Okay, then let's move on to the ischium. Please, I'm done with the ilium. Let's move on to the ischium. The ischium. The ischium forms the lower 2/5 of the acetabulum. So take note of these points. The ischium. The ischium forms the lower 2/5 of the acetabulum. It is made up of the following structures. The following areas constitutes the formation of the ischium. It has a thickened portion. This is the part that I'm talking about. Known as the ischia tuberosity. The one whose baby is crying, please just take care of the baby and then mute yourself. So it has a thickened portion known as the ischia tuberosity, upon which the body rests when sitting. Yes. Now, if you allow your child to make noise and disturb the class, we'll put you in the waiting, and you can never ever join the class again if that is what you want. Period. So that you can join the class again. You are not the only person that we are teaching. So please. Okay. So I'm saying that the ischium forms the lower 2/5 of the acetabulum. It consists of a thickened portion known as the ischia tuberosity. This side is what I'm talking about. And that is, it is the part or the portion that the whole body rests when you are in a sitting position. Now, it also has a sharp eminence or spine known as the ischia spine. Please, can you let me tell you that you can No, listen, what you can do is whoever makes noise, please put the person in the waiting room, sure, and leave her there. And you put her in the waiting. That's what I've been doing to them when I'm using my phone. Put the person making noise in the waiting room and leave her there. So she can't enter again. So I'm saying that the ischium has a sharp spine known as the ischia spine. It is this ischia spine. Please, every portion of the bony pelvis that I mentioned, I tried to explain its significance, its importance in midwifery. The importance of that structure in midwifery is very, very important, because if you don't link it that way, then there's no point learning the anatomy. So I'm saying that this is the ischia spine. Please, can you see? When even I turn it this way, you can see it better this way. These are the ischia spines. The ischia spines it plays a very vital role in the life of the woman when it comes to delivery. So we'll talk about its spine later. The ischia spines separates the greater sciatic notch. Please, can you all see the greater sciatic notch? This is the greater sciatic notch. That is the sciatic notch, this side. And this is the ischia spine that I'm talking about. That's the ischia spine. So it separates the greater sciatic notch from the lesser sciatic notch. That is the ischia spine. This sciatic notch, it is for the passage of sciatic nerves. It is for the passage of sciatic nerves that supply the bony pelvis. So that, if you remember when you went for the nursing program, when they were teaching you how to give injection, they said, divide the buttocks into 4 quadrants. This is where the muscles of the buttocks are. So you divide it into 4. Then you give the injection at the outer quadrants of the buttocks. There's a rationale behind it. The reason why it is so is that we said this greater sciatic notch allows for the passage of sciatic nerves, which supplies the pelvis and the leg. And so if you don't divide the buttocks in the 4 quadrants and give the injection at the upper outer quadrants, the moment you get closer here, you are going to damage the nerves, the sciatic nerves. Then after giving the injection, the individual child or individual person becomes paralyzed. Some mothers have been complaining. I sent my child to the hospital, they gave injection, the child couldn't walk again. It's because that midwife didn't know, or that nurse didn't know this thing that I'm telling you. And so she gave the injection into the sciatic nerves and damaged the nerves, and then the individual became paralyzed. So I've told you the importance of the sciatic notch. Give injection at the outer part of the buttocks, then you dodge the penetration or puncturing of the sciatic nerves. I hope it's okay. Still on the ischial spine. Still on the ischial spines. The importance of the ischial spines is that if it protrudes too inwardly, if it protrudes too much, a certain diameter is blocked. It reduces a certain diameter of the pelvis. Please, any idea? Anybody? I want your contribution. Not only spoon feeding. You need to know. If the ischial spines are too sharp, too projected, too much projection in the ischial spines will cause something. Anybody? I can see people's hands up. Those whose hands are up. Yes?
It will cause obstructed labor.
It will cause obstructed labor. Thank you. Your name?
That Adokwa
Adolf Amankwa. Okay. So thank you very much for that contribution. If the ischial spines are too sharp, what happens is that it reduces the transverse diameter of the pelvic outlet. It reduces the transverse diameter of the pelvic outlet. So look at my hands. That is somebody's extra ischial spines. Can you imagine? The ischial spines are there, but somebody is having a projection. The person is having projection of the ischial spine. So I'm using my fingers to let you know the excess ischial spine that the individual is having. And see how it is blocking the pelvic outlet. So that if the baby should pass through, it wouldn't be possible. It will end up having what you call deep transverse arrest. Deep transverse arrest. So that the baby's head will be like this. Look at my fingers as the extra ischial spines and see how it is arresting the head. Now look at it. The baby's head cannot come because this ischial spines is arresting it. Any question? Any question, please? Shall we move on? Shall we move on?
Yes, please.
That's right.
Yes, ma'am.
Good.
Yes.
Okay. So that is the ischial spines. Now we are still on the ischium.
Yes.
We have talked about ischial tuberosity, upon which the body rests when sitting. Now it has what we call ascending ischial rama. Look at this. This is a ridge of bone, one here, one there. This is the ascending ischial rama. It is coming from the ischium, hence the name ascending ischial rama. Then there's still another bone, even though there's no joint here, but there's a bone coming from the pubic bone. That is also the descending pubic rama. So we have ascending ischial rami and descending pubic rami. And with similar structure at the opposite side, the pubic arc is formed. The pubic arc is formed, and it should incline at an angle of 90 degrees. The pubic arc should incline at an angle of 90 degrees. This afternoon, I will be taking you through labor, and I will dwell more on the pubic arc and how the midwife will be able to know that this pubic arc is inclining less than 90 degrees, or is wider than 90 degrees, and what is its effect on labor. We'll talk about that when we start labor this afternoon. Is that okay? Are you there? Are we okay?
Yes,
Madam.
Yes, sister.
Okay.
Yeah.
So that is the ischium. Now, let's talk about the pubic bone. Please, do you have any question on the ischium before I move on to the pubic bone? Do you have any question?
Yes, sister, I have a question.
Ask me, madam.
Sister, please, did you say that the ascending ischial rami meets with the descending pubic rami?
Yes, that's what I said. But then I said, even though you can't see a joint, but there are two bones that are merged together. I said that. And I said that with the ascending ischial rami meeting the descending pubic rami, with similar structure at the opposite side, the pubic arc is formed. The pubic arc is formed. That's what I said. Is it clear now?
Yes, sister.
Yes, sister.
Okay, fine.
Yes, sister.
Okay. So now, let's move on to the pubic bone. The pubic bone, in fact, it forms part of the illuminate bone. So that is the pubic bone. It extends here, it extends down. The pubic bone, there are two flat bones that are joined together. They are joined together by a part of cartilage. A part of cartilage known as the symphysis pubis. We have been talking about symphysis pubis, symphysis pubis. It is a part of cartilage. It is a part of cartilage that joins the two pubic bones to form the symphysis. The symphysis pubis, by saying, is a part joining the two flat bones. That is the pubic bones. Now, the pubic bone, I've already told you, has a ridge of bone that descends down to join the ascending ischial rami to help in the formation of the pubic arc.
Hajia, please come again. Can you please repeat yourself?
Okay, I will repeat myself. I'm saying that the pubic bone, there are two flat bones that are joined medially by a part of cartilage known as the symphysis pubis. And I said the pubic bone has a ridge of bone that goes down, and it is known as the descending pubic rami. And I said it joins the ascending. Ascending means you are going up. Descending means you are coming down. So the descending pubic rami is coming down. Then it joins the ascending rami, and we have similar thing here. Together they form the pubic arc. which should imply an angle of 90. Madam, that is what I say. Is it okay? Can I move on?
Yes, sister.
Yes, sister.
Yes, sister.
Yes, sister.
Superior. Superior. The one who stands is the serving, will put you in the waiting room, and you will remain there till we finish the lectures. You will remain in that waiting room till we finish with the lectures. So you better address it now. Okay. So superior. The pubic bone has a ridge of bone. It has a ridge of bone known as the superior pubic rami. One is ramus, two is rami. So it has superior pubic rami. And this superior pubic rami also joins the iliopectineal eminence. The superior pubic rami, it also joins the iliopectineal eminence. Now, please watch out. The formation, sometimes we may meet it in objectives, so take note of it. The formation of the superior pubic rami, the descending pubic rami, and the ascending ischial rami creates a hole known as the obturator foramen. Yes. Known as the
Madam, take it again.
I'm saying that I can't get that in this one. So I'm saying that the position, you can put it in, the position of the superior pubic rami, then the descending pubic rami, and the ascending ischial rami creates a foramen, a hole, and that's what I'm pointing at. It creates this hole, and it is known as the obturator foramen. It is for the passage of obturator muscles, for the passage of nerves and lymphatics. The lymphatic drainage of the pelvis will pass through the nerves, it will pass through this lymphatic drainage through this obturator foramen. So that in objectives, if we should ask you which of the following bones constitutes the formation of the obturator foramen, then you should know it is these three bones. That's the superior pubic rami, the descending pubic rami, and the ascending ischial rami. But maybe in objectives we'll bring a whole lot of things. But once you know it, you should know which bones constitute the formation of the obturator foramen. Any question? Any question, please?
Yes, sister, I have a question.
Ask me, madam.
Please, you said the obturator foramen allows the passage of the lymphatic drainage of the, is it the pelvis?
I said lymphatic nerves, blood vessels, they pass through this obturator foramen.
Okay, thank you.
To supply most of the organs, to supply the pelvis itself and supply most of the organs inside the pelvis. You know, in the beginning, I mentioned all the organs that are situated in the pelvis. I mentioned the uterus, the bladder, the vagina, fallopian tubes, the ovaries. I mentioned all those, and in fact, part of the small intestines also rest on the pelvis. So when the blood supplies are coming, it will pass through this obturator foramen and get there to supply organs that they are targeted to supply. Any question? Please. Yes.
Please. Sorry for asking again. You made mention.
You have to be there.
Okay. The formation is the superior pubic rami, the descending rami, and ascending. That's what I didn't hear. Ascending
ischial rami, and that's what I'm pointing at. I think I'm pointing to you. Look at it. Look at it. This is the rami. And then from here to this side is the descending pubic rami. Then this part here, the upper part of the pubic bone, this side, is also called superior pubic rami. This one has the descending pubic rami, but this one is called superior pubic rami. They are all attached to the pubic bone. Okay, but then the ascending ischial rami is coming from the ischium. I hope it's clear.
Yes, please.
Yes, please.
Okay.
Thank you.
You're welcome. Can we continue? Can I continue?
Yes, please.
Yes, sister.
Okay.
Yes,
Yes,
please.
sister.
Okay. So now I'm done with, we are all done with the description of the pubic bone, the illuminate bone. So I've spoken about the pubic bone, the ischium, then the ilium. I'm done with that one. They form the lateral wall of the pelvis. Okay? Now, let's see the structure, the bone that forms the posterior wall of the pelvis, and that is the sacrum. That is the sacrum.
Hello, sister. Sorry, I want to ask a question.
Oh, ask, please. You can go ahead.
Please, when you were mentioning the superior, the ascending and the descending, I realized that you always link it to its function. But you didn't mention any function of the pubic bone. Does it have any function in terms of the formations of this bone?
Yes. Yes.
What does it?
The function of the pubic bone, one, it forms the anterior wall of the pelvis. Thank you very much for reminding me. That is academic honesty. Yes. It forms the anterior wall of the pelvis. And because of the way it is short, it makes the anterior wall of the pelvis being shorter than the posterior wall. So the anterior wall of the pelvis measures 4 centimeters. The posterior wall measures 12 centimeters. So it's like 4 times that of the posterior wall. Is that okay? Now, apart from that, another importance of the pubic bone is that in obstetrical conjugates, there's something that we call obstetrical conjugates, and then we have anatomical conjugates. You are using the obstetrical, you are measuring obstetrical conjugates from the posterior part of the symphysis pubis, from the top of the pubic bone, about 1.25 centimeters behind it. Please take note of it. When you meet it in objective, you should be able to select the right answer. I'm saying that the pubic bone is very important in midwifery because the fetus, when it enters the pelvis, it uses what we call the obstetrical conjugates. We have 2 conjugates. No, there are even 3. We have, on top there, we have 2. That is the obstetrical conjugates and then the anatomical conjugates. The anatomical conjugates is measured from the top part of the pubic bone. The obstetrical conjugates that the fetus uses, take notes. While the obstetrical conjugate that the fetus would use to enter the pelvis, it is.
Sister, please let the pelvis come up a little bit.
Is it okay?
Yes. Yes, sister.
Good. Good. So when the fetus is entering the pelvis, it uses the obstetrical conjugates. That is a point behind the symphysis pubis, about 1.25 centimeters from the top of the symphysis pubis. So that, watch out, if this baby is coming, because the top part here is the anatomical conjugate, the baby didn't use the anatomical conjugate. But when you use, and watch, it will use the obstetrical conjugate, and watch out. You see the baby's head is entering. It is not coming up here. It is entering, and it will use the obstetrical conjugate. And I said that measurement is taken from a point behind the pubic bone or the symphysis pubis, about 1.25 centimeters to the promontory of the sacrum. And that is what the baby will use to enter. First, it will use this side, and then it will enter this way. It wouldn't come above it. If it comes above this diameter, that will be abnormal. It's a different thing altogether. We won't come to abnormal labor now. It will be abnormal where the woman will even be having pendulous abdomen, because the head is overlapping. The diameter that is supposed to use, he didn't use, is overlapping the symphysis. And that one becomes abnormal. We are led from abnormal. So this time we talk about abnormal. So all that I'm trying to say is that the pubic bone and then the symphysis pubis. Now, another significance, another importance of this symphysis pubis is that if you are a midwife, this is just by the way, it's not part of the anatomy, but it will go into labor. If you are a midwife, and after your assessment, you assess the fetal head using the FIPS, and you realize that at the 36th week, baby's head is still hanging up. It is not entering. It's not entering, it is up there. It means there's something wrong in the pelvis that the baby is finding uncomfortable, and so it cannot enter the pelvis. So that is another importance of the pubic bone in the symphysis pubis. For some reason, if the midwife doesn't know this diameter that we are talking about, and she allows labor to continue, there's going to be what we call spontaneous symphysiotomy. Spontaneous symphysiotomy. The symphysis pubis will give. Once it gives, it is wide apart. It will take the woman about a full 1 month before the bones can unite again. And so, when you are abdominal examination, don't allow that big baby to pass through that small pelvis. Don't do that. Anyway, we'll talk about that in labor. So that is what. So it's very important to be. That is the significance of, yes, there can be spontaneous.
You just mentioned.
And it will affect the working of the woman. After delivery, she can say, "Mommy, get up. Let's go to the lining inward." She can't, because the pelvis is gauged. There's spontaneous symphysiotomy because of your poor assessment that you did during the abdominal examination. Is that okay? Hello.
Hello.
Yes.
Hi.
Hi.
Okay. So now,
Hi.
It's interesting.
interesting. That's good.
Thank you very much.
Hello, sister, please, I have a question.
Ask me, madam.
Okay, my name is Esther Ajimayekwa. Sister, please, I wanted to ask if the obstetric conjugate to the promontory of the sacrum, the diameter which is 1.2.
Oh, somebody is
But can it?
Somebody is talking. Can you take
Please mute yourself. The person asking.
Take the question again. Take the question again. Go ahead.
Hello, sister. Please, I'm asking the obstetric conjugate, which is 1.2 to 5 centimeters, to the promontory of the sacrum. Can it decrease from 1.2 to 5 to any other figure? Can it decrease it?
Please, if somebody had the question, and tell the person making noise, who put her in the waiting room. We'll put her in the waiting room and she can never join the group again. Until the
Sister,
next
please set a
lecture.
scapegoat. Set a scapegoat. They are disturbing.
Please, if you are not answering the question, mute yourself. Hey.
Hello, sister.
Please go ahead. Go ahead and ask the question again. There's somebody making too much noise. Please, once you are here, there's somebody making too much. Somebody is asking a question. I'm answering her, and she is there making noise. She and her children are making noise. If she comes again, put her in the waiting room, and she can't enter to make any noise. Okay. Please go ahead with your question. I beg you. Please go ahead. Oh, we have noted all of them. Then when I say you should
Please,
ask,
I would like to ask a question. With the symphysis periods, you mentioned later part that it can gape. And if it gape, it takes a woman 1 month to recover. But from the beginning, you made mention of that the pubis contains certain organs, which vagina, bladder, and other parts are all in the.
It is the pelvis itself that contains these organs. And not the symphysis pubis.
Yes.
It is the pelvis
Yes.
itself that contains all these organs.
Okay, yes. Point of correction. Thank you. If the pubis gape, is it possible for the woman to recover within that short period?
Well, if she's managed well, you know, we have to inform when it happens like that as a midwife. Inform the obstetrician, inform the physiotherapist unit, so that they will apply a band, proper band. Sometimes they can even use a whole bed sheet and then tie the buttocks and the waist together. The essence is we are bringing it back to its normal position, so that and then she will be in bed for that long time. And then you can imagine she will have to be on fluid diet, catheter in situ, so that defecation becomes minimal.
Okay.
That is how to manage such a issue. It's very unpleasant, very unpleasant. So don't let it happen to any woman.
Yes, sister.
If the baby is big, you never see it. You have a live baby and a live mother. And of course,
Please, I have a question.
Ask me. We are here to describe the sacrum and the coccyx. So please let's hurry up. Ask your question.
Please, I'm Emilia Dawson.
Okay.
Please, with the pubic bone, the importance, you were saying it forms the anterior wall of the pelvis, and also
I'm having
the anterior wall is made up of a certain measurement. That one I didn't get it well. And the posterior description, you said that portion is short. I'm confused over there.
Oh, don't get confused. My dear, what I was saying is that
Hello.
I said the pubic bone is short. There are two short flat bones forming the anterior wall of the pelvis, making the anterior wall to measure 4 centimeters in depth. It measured 4 centimeters in depth. But the posterior wall that is formed by the sacrum measures 12 centimeters. And so it means the posterior wall is longer than the anterior wall. And you can clearly see it. Don't you see that this side, from this side to this side, being the posterior wall is longer and deeper. But then look at the anterior wall. Look at the measurements. You see? It's very short. That's why it measures 4 centimeters. That is all that I was trying to see. And that is why when we start with inclination, you understand it better. So that when you are in the upright position, when you stand in the upright position, you realize that because of the short nature of the anterior wall, the pelvic has a certain inclination that it will incline at the rim, at the cavity, and then at the outlets, just because of the shortness of the anterior wall.
So, sister, what's the measurement for the posterior wall?
It is 12 centimeters, 12, 1, 2, 12.
All right.
12.
And then the anterior one is the 4.5.
No, I didn't mention
or 4.
I said 4.
4. It's 4. 4. All right. Thank you.
So now the posterior wall is the pelvis. It is formed by the sacrum. Look at the sacrum. That is the sacrum. Can you see the sacrum? That's the sacrum. That is the sacrum. It forms the posterior wall of the pelvis. It is shaped like a wedge. It is shaped like a wedge. Or better still, you can say it is triangular in shape. Triangular in shape, with the base pointing up and then the apex pointing down. It has a base and it has an apex. And so is the shape of the sacrum. So I'm going to use the anterior, posterior, superior, inferior, lateral, medial way to describe this sacrum. The sacrum, I said, before the posterior wall, I've already said it. Maybe the posterior wall of the pelvis a bit deeper, measuring about 12 centimeters. I've already said that. Now, posterior, before the posterior aspects, let's see where we can locate the sacrum. The sacrum, there are 5 fused bones. There are 5 fused bones, 5 vertebral bones that are fused together. The sacrum are 5 vertebral bones fused together. Sacral bone articulates, better still you can say joints or meets the 5th lumbar vertebrae. It meets the 5th lumbar vertebrae to form the lumbosacral joint. Take note of this. I'm saying that the first sacral vertebrae articulates with the 5th lumbar vertebrae to form the lumbosacral joint. Now, the center of the first sacral vertebrae has a projection. The center, and that is the center. Please watch. This is the center of the first sacral vertebrae. And it has a projection known as the promontory of the sacrum. You can still say sacral promontory. I'm saying that the center of the first sacral vertebrae is known as the promontory of the sacrum. Let's say its importance in medicine. The significance of this promontory of the sacrum is that when it projects too much, it reduces the anterior posterior diameter of the pelvic rim. Please take note of this, because as a midwife, if you don't know much about this promontory of the sacrum, all the babies that you deliver will end up having problems, either intracranial injury or maybe becoming severely asphyxiated because of something. Because of the protection of this that you, the midwife, didn't know, and you allow normal delivery to continue. But as a midwife, you should be able to identify, even for the promontory of the sacrum during vaginal examination. And that measurement, it is the only measurement of the pelvic rim that is measured per fine. Please, I'm saying it again. Pay attention. I'm saying that the measurement of the brain, that is the measurement from the promontory of the sacrum to the under surface of the pubic arch. It is the only measurement that is measured per vagina for the brain. And it is called diagonal conjugates. That measurement is called diagonal conjugates. It measures 12 to 13 centimeters. It measures 12 to 13 centimeters. It is called the diagonal conjugate. And this one I'm telling you for a tip. There's no objective that I'll bring without bringing this measurement there. There's no objective question that Hajia will set and she won't bring in this diagonal. It was so dear to me. So I'm repeating it so that you understand. I'm saying that the diagonal conjugate, it is the only measurement of the pelvic brain that is measured per vagina. It is measured from the under surface of this symphysis pubis to the center of the promontory of the sacrum. And it measures 12 to 13 centimeters. Please, do you understand? Do you?
Yes, sister.
Yes.
Sister, please, can you come again?
Please take it again.
Sister, please come again.
I just said she heard it, and she can say it actually. What is the name? Let me look for it. Don't dodge. Priscilla, Priscilla. Priscilla, here. What is doing here? Priscilla. Okay, I'm done.
Madam, I'm here.
Okay.
Madam, I'm here.
Yes, please.
Hey. Madam, please, I heard that it is the only measurement per vaginum, and it measures 12 to 13 centimeters.
Okay. There are some omissions. Somebody should add that. Somebody should add that. He has omitted certain important facts. Somebody should add that.
Ma'am, please.
Please,
You said it's also Emilia Dawson.
Okay.
You said it also measures from the under surface of the pelvic brim to the center of the sacral promontory.
And it is the only measurement
that can be assessed vaginally.
Okay. So I said that diagonal conjugates, it is the measurement of the pelvic brim. It is the only measurement of the pelvic brim that is taken per vagina, and it measures 12 to 13 centimeters. It is taken from the under surface of the symphysis pubis to the center of the promontory of the sacrum. That's what they say. Okay. Now still on the sacrum.
Please, Hajia.
Yes, madam. Yes, madam. Go ahead, I'm listening to you. Hello? Please go ahead, I'm listening to you. Okay.
You said it measures from the under surface of the symphysis pubis and what, please?
To the center of the promontory.
All right.
To the center of the promontory of the sacrum. It is measured per vagina. Okay. Now, still on the sacrum, I'm still going by anterior posterior something. Anterior, please pay attention to this point that I'm telling you, so that you apply it in the midfield when it comes to labor. Anteriorly, the sacrum is concave. Anteriorly, the sacrum is concave. Please, can you see the concavity? It's concave. And it is known as the hollow of the sacrum. It is known as the hollow of the sacrum, and that is the hollow of the sacrum. Hollow of the sacrum. Its significance or its importance in midwifery is that the baby hides its face in the hollow of the sacrum during the second stage of labor. It hides its face in the hollow of the sacrum during the second stage of labor. And that explains, and remember, that is why the rectum is also lying. The rectum is also lying in the hollow of the sacrum. And so those of you who manages, who manage first stage of labor without emptying the rectum. If the rectum is loaded with feces, and you the midwife, you are not able to detect that the rectum is loaded with feces, then you can't call yourself a good midwife. Because the rectum is lying in the hollow of the sacrum, and the baby is coming to hide his face in the hollow of the sacrum, what do you think the baby will do? What do you think the baby will do? It will use that beautiful face, that soft, beautiful face of the baby. The baby will use the face to strip out the feces. To strip out the feces. So to get the place to hide its face. And that's why especially the stool, the feces is the fated type. And the stubborn feces that flash at it.
Interesting.
On top of the WC. Such feces, there a baby is using the face to strip it out. The baby comes and you see blue on the skin of it. I don't know whether you have observed. You will see bruises on the baby's cheek, on the forehead. It tells you straight away, it tells you that after constipation, constipated out. So that it means that when you contact V and the rectum is loaded with feces, and the cervix has not dilated up to 6 centimeters, at this stage, give enema. Give enema to wash the rectum and clear the feces so that the hollow of the sacrum will be empty for the baby to hide his face there. I can't remember there was a group that where I was telling them this. Then somebody said, "Hey, you can say that, yeah, not animal."
Even animal way.
And at the end of the day, people will know whether you like it or not. People will use the face to pick out the feces, and it comes out first.
It's true. These phases I've experienced some before.
Yes, and you people talking about what do you call it? First point. You midwife will be mentioning it as a first point.
Please, the enema is raw water.
It is physics. But if you had managed the woman well during the first stage of labor, the baby wouldn't have used the face to strip out the feces. Please do it. So this is one function of the hollow of the sacrum. Another function is that it increases the way it is concave. The concavity. Because the way it is concave, it helps to increase the anterior-posterior diameter of the pelvic cavity. Take note of it. The same, the way it is concave or it is curved, it allows the increments of the AP diameter of the pelvic cavity. How from the baby hiding his feet to his second stage in the hollow of the sacrum. Please, that is it. Now, let's go to the lateral side of the sacrum. Laterally, there are 8 pairs of foramina. In fact, it is 4 pairs of foramina under normal circumstances. So there are 8.
I will throw the basket away.
There are 4 holes at the side. Please, you can all see the holes. You see the holes. There are
Yes.
holes.
The man here, he didn't still find this medication by his side. The losartan, we're checking it. There's no medication by his bedside.
Hello, sister. Question.
Ask me. Ask the question. I wanted to.
Hello, sister.
Yes.
So, sister, please, when the physics is not coming, can you do a manual removal?
Okay, you say what? What did you say?
When the physics is not coming, when the physics is not coming, can you do a manual removal when the patient is in labor?
No, like the person removal wouldn't help, especially in the constipated type. It is going to cause some scratches in the rectum. A patient after delivery will complain that her rectum is paining her. Why don't you give the enemy? You apply some Vaseline. That's why we have to tell them to bring their own Ventura. During the AS, they to bring their own Ventura. So that you give the enema pump. So that you give them warm enema. Enema supplements. Give her a warm enema, it will stimulate the rectum.
Okay, sister.
The empties it will stimulate uterine contraction once the rectum is emptied. I hope you get it. It is
yes, please.
When the cervix has dilated more than 6 p.m. that we don't expect you to give her enema. Because if it is more than 6 p.m. and you give the enema, it is going to accelerate the delivery process. And the mother, it will cause uterine contraction in addition. And the mother is likely to push the baby into the WC, especially if she's a multiparous woman. Especially if she's a multiparous woman, then you don't go there, you don't go near the enema. But if you give that whose service has not dilated up to 4 cm, if it is a multiparous woman, her service has not dilated up to 6 cm, give the enema to clear the feces. So the baby is coming and the mouth, the face, it's all messed up with feces. You don't want your baby to smell that kind of thing. You think that the baby is having kata, you don't know where the kata is. Oh my goodness. Let's practice good video free, okay? Hello.
Man, the enemy. Hello, man. Hello, man. Hello, Justin. Please, the enemy you are talking about, I'm not getting it. Please, man, the enemy you are talking about, I'm not getting it.
Oh, I'm saying that during the first day of labor, the rectum is loaded with feces. That is the animal I'm talking about. So that the feces become for her to evacuate it out. So that when during second stage of labor, the baby will get a place to hide its face, and normal delivery will ensue. That is all that I'm trying to say.
Sister, please, with the enema, is it raw water?
It's water. That's what I said.
Okay, thank you. Sister, question. Another question, sister.
Okay.
Sister, question.
Yeah.
Sister, please. So when they are coming, they are delivering at time. Does it mean they went to an Ebeka who provide it from ourselves? Yeah, because I went to
during the health center. Them to add the onto one in addition to the items. Because of HIV/AIDS, this time you can't use one person's blood for the other patient. So your father quality on your manufacturer. You got them moving here, say a best sour. You best sound shoot there. Now I'm not waiting here for toilets. Now about banana. Because of this anatomical structure that we're talking about. Hello. So that's
understood.
Hi.
Hello.
Hi.
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 We can hear you.
Okay. So now it's left with the lateral side of the sacrum. The lateral side of the sacrum. It has wings. There's a flat out area or wings of the sacrum, which is known as the ally of the sacrum.
Question. Yeah,
Who is ally? The one making noise, I'll put you in the waiting room. I won't just meet you. I'll put you in the waiting room. We have reached a very important area and you are talking. If you're not interested in the lectures, why don't you mute yourself and go and do your own thing? When it reaches examination, we shall see who will be falling. I entered and it didn't go. It didn't go. I said, paying attention. So please, be mindful when for lectures. Okay. So I'm saying that there's a flat out area which is known as the ally of the sacrum. Ally of the sacrum. One is ally. The plural form is ally, but when it is single, it's ally. So ally of the sacrum, that is important. It helps the way it is played out. It helps to increase or widen out the brim of the pelvis. Again, it also articulates with the medial aspects of the ilium. I mentioned it when I was describing the ilium. It joins the ilium, the ally of the sacrum, joins the medial aspect of the ilium to form the sacroiliac joint. And I mentioned earlier on that it is the strongest joint in the body. I said it. Okay. Now, for some reason, in some mothers, there's congenital malformation. There's congenital malformation where one of the ally wasn't developed. It's missing congenitally. And when it happens like that, the pelvis no more attains the name gynecoid pelvis. It is rather known as Naegele's pelvis. Some people will say Naegele, but Naegele's pelvis, meaning one of the ally of the sacrum is missing. It's not there. And it is evidenced by the way the woman was. So that if you are a midwife, you are in the labor suit, a patient is coming, or you are the antenatal, and patient is they are coming one by one, you are attending to them. She gets up to come, and you see that she's having a waddling gait. Patient is having a waddling gait. You ask her, she gets up, she's coming, and it's like she's doing that. Please, you should know that there's something wrong with her pelvis. And it may not favor normal vaginal delivery. So that gait alone, the gait, the structure, the way the woman is working, is enough to tell you, the midwife, that this patient may not be able to deliver her vagina. So note it on the folder. Please, do you understand? We call that one Naegele's pelvis. Now, in some situations, in severe form of congenital malformation, these two both may be missing congenitally. The woman is not having the ally of the sacrum. And that one, the name Robert's pelvis is described. Robert's pelvis is described. If the woman is having both ally of the sacrum missing. And I used to tell students that for you not to get confused, because you meet it in objective. Yeah. So take note of it. How you can remember, at the end of the year, Nicholas pelvis, the end of Robert's pelvis, please take it. Adult learners, take it this way. Nicholas pelvis, when you are spelling it, it starts with N-A-G-A, again, then LEVS. So then, when we are to describe one, you still have N there. I don't know whether people are following what I'm saying. I just want to give you a clue so that you don't get confused with which one is the necklace pelvis and which one is the Robert's pelvis. And that will give you a clue for you to remember. The necklace, when you're spelling, you have the letter N there. The word one, when you are describing, you have letter N there. And so then it goes with one ally mason. Does it make sense to you? Hello? Hello? Can you hear me? Hello? Am I heard? Hey. What do you see? What is being now? They can't hear me and they are listening to the page. Please, can you hear me? Okay. Hello?
Hi. Yes, sister, we are there.
Oh, okay. So what did I say about the necklace pelvis? What did I say about the necklace pelvis?
Sister, please, you said that one Allah is missing. One Allah of the sacrum rings is missing. When it has only one, then it is Nagelin's pelvis. Hello.
And then when both Allah is missing, it's known as
the Robert's pelvis.
Robert's pelvis. And I was giving you a scenario where you can remember. That's where I got to. So Robert's pelvis, rob. The person has been robbed of the true Allah of the pelvis. And so you can remember when you meet it in objectives, you don't become confused. You should be able to come out with the right answer. Okay. So far, it's left with the coccyx. Left with the coccyx. The coccyx is also for. Please, do you have any question on the sacrum?
Yes, please, sister.
Yes.
Sister, please. You said the way is concave. And it allows the increments. Please, that point, I didn't hear it well again.
I said it causes increase. It increases the anterior posterior diameter of the pelvic cavity because of the way it is concave. Because of the hollow of the sacrum. I was trying to tell you the two functions of the hollow of the sacrum. That apart from maybe hiding its face, it also increases the posterior diameter of the pelvic cavity. That's what I said.
Okay, thank you.
Okay. Now the coccyx. The coccyx are four vertebral bones that are fused together. The coccyx, there are four vertebral bones that are fused together. And it tilts backwards. It tilts backwards. It goes back. Because it joins the tip of the sacrum. It joins the tip of the sacrum to form the sacropostiliar joints. Please take note of that. I said the coccyx are four fused bones, irregular fused bones that joins the tip or the end of the sacrum to form the sacropostiliar joints.
Sister, please, we can't see the pelvis.
Hello?
Sister, please, we can't see the pelvis.
Can you now see? Can you see? Please, can you now see? I said the coccyx is here. There are four irregular bones that are fused together and it joins the tip of the sacrum to form the sacropostiliar joints. This joint is important in midwifery because during second stage of labor, the coccyx tilts backwards. Increase the anteroposterior diameter of the pelvic outlet. So those of you in the delivery series, if you remember, when you conduct delivery, during second stage, when you manage the woman, getting to second stage, the patient will be complaining that her coccyx, her sacral region is paining her. It's because the coccyx is attempting to go back, tilt back, increase the AP diameter of the pelvic outlet. It is painful. Please, do you understand? On this note, I've done with the description of the pelvis. Any question? Hello? Hello? Can you hear me? Yeah, I can see your hand up. Mami K, I can see your hand up. Do you have any questions for me? Okay. Mama said that you your own meeting. Please, do you have any question for me? I'm done with the description of the pelvis. Please, what I want you to understand is that the types of pelvis was discovered by CODeL and Molloy. CODeL and Molloy. The types of pelvis was discovered by CODeL and Molloy. It is spelled like CALD. WELL. CODeL. And then Molloy. Molloy is MOLLY. Molloy. They discovered the 4 types of pelvis. So that we have the gynecoid pelvis, the android, the platypuloid, and the anthropoid. And then we have gesto-minor pelvis. Gesto-minor pelvis is a type of pelvis that is gynecoid pelvis, except that all the diameters are reduced. So we'll talk about types of pelvis the next time that we meet. Go and read on the types of pelvis. Okay. Any question? Please, I'm done with the description of the pelvis. Hello? Hello? Can you hear me? Oh my goodness. Please, can you hear me? Please, can you hear me? It's honorable. You have muted all of them. Come and mute them. Hello? Please, I want to sing the pelvic sound for you, so that those of you who are teachers in the classroom, you can also teach your students. So, hello.
I have a question.
Hello,
You have a question. Okay, ask me.
Please, we're about to talk about the holes that are formed by the 5 fused bones, but you didn't continue.
The 4 fused bones. The joint.
The coccyx is made up of 4 irregular bones. I continued. I said 4 irregular bones.
I'm talking about the sacrum. The sacrum. The holes that are made by the 5 fused bones. 4. The 4 pairs of holes.
The coccyx. Oh, have you forgotten the anatomy of the vertebral bones? Maybe you have forgotten the anatomy of the vertebral bones.
So we are talking about the sacrum.
The sacrum.
When you started, you were going to say that laterally there are 4 holes at the sides of the sacrum, but I didn't complete.
Oh, I said it. I said the 4 bones. They are for the passage of the sacral nerves. That is all that I said about the 8 pairs of the 4 pairs of foramina. I said it, my dear. I said it is the 4 pairs of foramina are at the sides, and they are for the passage of the sacral nerves. That's what I said. They are for the passage of sacral nerves. And this nerve, mind you, these sacral nerves, you know, they at the end, they form a tout of nerve. They form tout of nerves here, known as the cauda equina, a bunch of nerve between the, normally it is between the between the 3rd and the 4th sacral nerves, vertebrae. 3rd and the 4th vertebrae. That is where you find this cauda equina. It is in these nerves that the anesthetists normally introduce their anesthesia to anesthetize the lower part of the body for cesarean section to be done. So it is important immediately. So that is all about the nerves. If you have forgotten the anatomy, the number of bones forming each part of the vertebral bones, you know, when we were doing nursing, I don't know, but there was this thing that even we used to make fun of it, like 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, 4 coccygeal. We were making fun of it, just for you to remember the number of bones forming each part of the vertebral bones. 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, 4 coccygeal. So I said 4 coccygeal bones, and I said they are irregular bones, and I said it goes back. The coccyx tilts back during the 2nd stage of labor. That is all that I said. I didn't add anything to it. And the vertebra, the foramina at the side, I said is for the passage of sacral nerves. I'm only left with the foramen magnum. Foramen magnum, that is the canal that lies inside the vertebral column. The canal, this canal. And we said it is called foramen magnum for the passage of the spinal cord. It is for the passage of the spinal cord. That is the foramen magnum. Foramen magnum. So, ladies and gentlemen, please, I'm done with the description of the pelvis. Unless you didn't understand something. Yes, ask your question. Go ahead. Yes. Please ask the question.
A question.
You said you have a question. I say ask me. Please ask the question.
Spinal cord is called foramen magnum. Please, can you spell the magnum?
Foramen magnum.
Magnum.
It's magnum. Question.
The spell is M-A-G. N-U-M. Magnum. Foramen magnum. It is for the passage of the spinal cord. And you all know that the spinal cord contains all the nerves that gives us the sensation, both sensory nerves and other nerves.
Sister, please, I have a question.
Okay, ask me.
Please, you said the
promontory of the sacrum projects and it can distort the diameter of the pelvic rim.
To reduce.
How
Yes.
does it project? What causes it to project?
Okay. Let's see. This is the promontory of the sacrum. Please, are we watching? That's the promontory of the sacrum. This one. And I said if it projects too much. So look at this pen. As somebody's promontory of the sacrum that is projecting. Please, have you seen? If it projects too much inward, it will reduce the anterior posterior diameter. It will reduce the anterior posterior diameter of the pelvic rim. It will reduce the anterior posterior diameter of the pelvic rim. So if this is the essence of somebody's promontory of the sacrum, can you imagine? It will reduce the diameter of the AP diameter. And baby cannot come. And remember, I told when we start labor this afternoon, maybe you appreciate it better. Because if promontory of the sacrum is projected, especially some people when they are walking, you can even see from behind. The way the buttocks are thrown back, and that curvature is there. You can imagine.
Please, my question was, what causes it to project?
What actually causes it to project? It may be a congenital malformation, but sometimes the girl child who carries heavy load before attaining the age of 20, especially the Kayayo girls, the girls who are going to the Kayayo, their promontory of the sacrum can be pushed forward because of the compression, carrying heavy load, compressing the vertebral column all the time. It can cause projection of this promontory of the sacrum. It can cause impaction and can lead to what we call rickety flat pelvis. There's another type of pelvis. Apart from the 4 main types of pelvis that was discovered by CODeL and Bolloy, there are other types, there are other classifications of pelvis. Then 4 main types we all know to be gynecoid, android, anthropoid, and then platyploid. There are still other types of pelvis that can be brought about as a result of this kayayothel, and then as a result of nutritional deficiency. There's a type of pelvis we call osteomalacian pelvis. It's as a result of nutrition deficiency or rickety flat pelvis. Rickety flat pelvis as a result of lack of vitamin D and C. The pelvis becomes flat. If the girl happens to carry heavy loads that tender age, can affect her pelvis. So that is it. Ladies and gentlemen, do you have any other? The one who asked the last question, have I answered your question? You said what brings about the promontory of the sacrum being projected? And I said it may be congenitally deformity. Congenitally, there's a malformation pushing the promontory forward. That one is there. And then the person's lifestyle, like I said, carrying heavy loads before you attain the age of 20, it can affect the spine, affecting the promontory of the sacrum, pushing it forward, so that it will always reduce the AP diameter. Every delivery, you have to go through cesarean section. I'm not saying that's the only thing, that's the only cause of CS, but it can contribute to that.
A question, please.
That's
Hajia, please, question.
Go ahead, dear.
Please, you were talking about the sacrum.
Yeah.
And I didn't get the function. I heard you saying it helps to. Is it the pelvic outlet or your posterior?
I was talking about the hollow of the sacrum. I was talking about the hollow of the sacrum.
No, I'm asking
And
I'm
I
asking about
said, because of the way it is curved, the hollow, because it is hollow, it helps to increase the anterior-posterior diameter of the cavity. That's what I say.
Oh, okay. What about the ala of the? It's widening out there.
And widen out the posterior wall of the pelvis. Yes, that's the ally of the same. Okay, you're welcome. Any more questions?
It's the question. Hajia, please.
Please, I have a
Hello, Hajia.
Yes.
Hello. Hey. Sister, please, my question is that I heard of the enema. The enema can it be given to only multiparent or knowledge who can be given? Yes. I heard you said it should be given to multiparent.
Please, is somebody hearing her question?
Oh,
because I didn't hear anything.
She said the enema, can it be given to a multiple or nullip?
Multiple.
The enema, okay. The enema, I said whether she's a multiparous woman or a primigravida, if the cervix has not dilated up to 6 cm and the rectum is loaded with feces, go ahead and clear the rectum by giving the enema. I said it. Whether she's a multiparous or a primigravida and cervix has dilated more than 6 cm, don't give the enema. That's what I say. That's what I want to see. Is that
please, when talking about the coccyx, you said they forms the 4 irregular bones fused together and tilt back during the second stage of labor. But you were saying that the 4 bones joins to form something. That one I didn't get it.
Please, whoever heard me, can you repeat that question for her? Did somebody hear me?
You said yes. You said it joins the tip of the sacrum to form the sacrococcygeal joint.
Okay.
And then its significance immediately. The importance of the coccyx.
And the coccyx, it said it's backwards and increase the AP diameter of the outlet.
Good. That's what I said. I said it tilts backwards. It moves backwards during second stage of labor to increase the AP diameter of the outlet to facilitate the passage of the baby through the birth canal. That's what I said. These all these things are very important. Other than that, when you meet it in objectives, you can't answer the right one.
Hello. I have a question.
Hello, Hajia, please, can we get short notes on this lecture?
Can you get what?
Short notes on this lecture.
Recording of this lecture.
No.
Oh, no.
No, please.
A slide.
Yeah.
Slide.
Yeah.
Being a recording.
I'm trying. My phone's here.
I soft copy. Note.
We want a note. No,
Please, Hajia, we need slides of this.
Like slides of this one of the
It's beautiful having you once again in my educational level. Thank you. God bless you.
Hey. Sister, please, the slide. So, will you get slide?
And handouts.
Hajia, can we get the best of this note?
Hello, Hajia.
Hello.
Hello.
Yes.
I have a question.
Okay, ask me.
Hello.
So after birth, and if the person complains of waist pain, does it mean that one of the nerves are at fault?
No, if one of the nerves is damaged, you end up with what we call foot drop. Please, when we are coming to do labor this afternoon, so we'll talk about all these things in detail. Okay?
Okay.
Please, can you get class of influencer?
Can you get
Yes,
Live.
Sister, please, question. Yes, those working at the remote areas, our network are very poor. Can we get slides for it?
Or
Slides
notes.
of
Can we get
yes.
notes on the
Short
lectures?
notes on what we just discussed.
Short
Or
notes.
a recorded version?
But the thing is recorded for you.
Oh, handouts. Oh, yeah, we know.
We are free.
You want handout?
Yes, please.
Yes, we want handout.
You want handout?
Yes,
please. We
Yeah,
want
handouts.
Yes, please.
And it's
Handouts
not
with
video
the
recording.
Okay, we'll think
Hajia,
about it and
please,
let you
we
know.
want
Sister,
lights.
we
Okay,
want
Hajia.
handout.
Thank
Yes.
you.
Hajia, we want handout.
Yeah, handouts will be better.
Okay, we'll work on it.
Sister,
We are working on it.
Oh,
Hajia, we want handout.
yes.
Okay, okay,
Yes,
we'll
please.
work.
Find a way.
Hajia,
The group is too
Yes,
noisy.
you compose yourself,
It's
please.
beautiful having you again.
Sister, question.
Sisters, please, please. The noise is too much.
Sister,
One after the other.
our network
Why?
is very, very
One
poor.
after
Sister,
the
so we
other.
want handout. We want
Please, let's
handout.
compose ourselves. We say it one after the other.
everybody wants to ask questions.
Network.
Time is up. Oh, if the time is up, please, let's wind up. Let's take the last two questions and then we can close.
My question
Come and take labor. You have
with the
labor.
red
Or you have labor at what time? 4:15.
4:15, yes, please.
4:15
Yes,
to
please. 4:15
to 6:15.
15.
To 6:16. Okay. Okay. Then so if you don't have much question to ask,
I want to ask a question.
Please, a question.
Ask the question and
My
let's
question is when the red do it, sometimes when you do you can feel the feces. Sometimes we use our hands to push it out. Is that one also advisable?
again. Did somebody hear her question that we can repeat for her?
When you do
Yes, please.
The
Auntie.
one who said yes, please. Repeat the question.
Please, you said during labor, when we push out the loaded feces, it causes scratches to the rectum, which causes injury to it. So it's good we give the animal
It causes
bruises to the rectum, which causes injury to it, and infections can set in. So it's good you give the animal. When the labor is not yet up to 6 centimeters.
Baby.
Okay. Yes, we are saying that if you give the animal, it softens the feces. It softens the feces, and then it can come out. You will serve her with the bedpan, and then she goes. It's because some midwives don't want to handle the bedpan containing the feces, and that is why they don't want to give the animal at all. But which is the biggest loss? I mean, which is the biggest something that you don't want to see? If you don't give the animal and the feces mess up the delivery field, look at the sort of infection that we are introducing both to the woman's vagina, and then to the urethra, and the baby also having infection. Sometimes the feces, I told you, will be smearing all over the mouth, the nostril. The baby's face is full of feces. Which one becomes more infectious than just not giving it? When you give it, it clears the rectum. And so it prevents the infection that we are talking about. At least it will prevent so many things. So it's good that we give the animal, if the cervix has not dilated up to 6 cm. Fine, go ahead, give it, clear the rectum, and then get a clear or clean delivery field to operate. That's how you're supposed to do.
Hello, sister.
You don't want to be carrying bedpan with feces. You don't want to do that, and it's very bad. That's the profession that we have chosen. So you should know how
Hello,
to
sister.
handle the bedpan with all dignity. Handle it with dignity. That is your profession. Okay.
Hello, sister.
Yes.
Sister, please, I want to ask a question.
Ask me. Go ahead,
Please,
madam.
looking at the function of the coccyx that tilts backwards during second stage. Normally the women, when they are in second stage, normally they assume the episiotomy position. Will that position prevent the function of the coccyx?
No, it wouldn't, madam. It wouldn't. It is internal structure. And once it bends on, tilting backwards, it will never, the position wouldn't affect it. Because this time around, we are even advocating for the fact that the woman should assume. The woman should assume any position of her choice. So it will never affect the coccyx tilting backwards. It wouldn't affect.
Okay, thank you, sister.
You are welcome. On this note,
please, Hajia.
Hajia, please.
Yes, ask your question.
Hajia, please, I have a question.
Ask me, madam.
Please, I want to find out. After tilting of the coccyx, how long does it take to come back after delivery? The coccyx, I mean the coccyx.
You say how long does it take?
After it has tilted back to increase the anterior posterior diameter. Yes, please. How long does it take to come back after delivery?
The coccyx.
I don't think that the time that
I mean the coccyx.
Maybe others may have an idea, but what I know is as long as involution is taking place, all the organs and structures that were involved in pregnancy and labor within 6 weeks, they should all go back to their pre-pregnant state. That is what I know. But as to a specific time, duration that you go, that one I haven't come across it. If you have come across it, share with us, please. But I know during the PP period.
Question.
Please, Hajia.
You say?
Please, the types of pelvis. You said it was discovered by something and Molly. I want to.
CODeL.
And Molloy. CODeL is CALDWELL. CALDWELL. CODeL. With his counterpart called Molloy. Molloy is capital MOLLOY. Molloy.
Discovered the first type of pelvis.
Yes, they discovered the types of pelvis.
Please, those of us working at the remote area.
Hajia, please, I have a question.
Okay.
We need handout of slide because our network is not
I said
stable.
okay. You have told me. I said okay. We are working on it. I said it.
Hajia, please.
Please, those of us working at the remote area.
And she said,
Hajia,
okay.
Yes.
Before the lectures is recorded, then she will still give handouts.
Hajia, please, during the labor time, are we using the same password to log in for the labor lectures, or we'll be giving another password
We are now
to?
at the GCUC studio. So let's find out from Honorable so that I'll go back to it. Hello. Hello.
Hi.
Hi.
Yes, ma.
Send it to the class and you get to know.
Okay.
Now we are starting at 4 something. So by that time, we would have given it to the course rep for you to get access to it.
Okay.
On this note, I think we'll call it a day. And
Thank you.
Please go and read on the types of pelvis.
Yes,
Hajia.